Welcome back to RN Zebra, where we break down complex health topics into easily digestible information. Today, we're diving into a condition that affects millions worldwide: anemia. By the end of this video, you'll understand what anemia is, why it happens, and how it can be managed. So let's get started. Anemia is more than just feeling a little tired or weak. It's a medical condition where your body doesn't have enough red blood cells or hemoglobin to transport oxygen effectively. But why does this happen? Anemia can stem from various causes, such as nutritional deficiencies, chronic diseases, genetic factors, or even blood loss. Imagine your body as a busy city with red blood cells acting as delivery trucks. Their main job is to transport oxygen from the lungs to every corner of the body. When there aren't enough trucks or they're running low on fuel, the city starts to struggle, and that's exactly what happens in anemia. But what exactly are red blood cells and why are they so important? Let's take a closer look. Red blood cells, or erythrocytes, are the most abundant cells in your bloodstream, comprising about 40 to 45% of your total blood volume. These cells are uniquely designed for their job, which is transporting oxygen from your lungs to the rest of your body and bringing carbon dioxide back to the lungs for exhalation. But how do these crucial cells come to life? The process is called erythropoiesis. Erythropoiesis process is stimulated by a hormone called erythropoietin. Erythropoietin hormone is secreted by the kidneys in response to hypoxia. Erythropoiesis starts in your bone marrow, where stem cells differentiate into erythroblasts. These immature red blood cells then go through several stages, filling up with hemoglobin and eventually losing their nuclei to become reticulocytes. Reticulocytes are released into your bloodstream, where they mature into fully functional red blood cells over 1 to 2 days. Once they're fully mature, red blood cells circulate for about 120 days, tirelessly delivering oxygen and picking up carbon dioxide. After their job is done, they're recycled by the spleen. But what happens when this process goes awry? That's when anemia can develop. Anemia isn't just one condition, it's a collection of conditions that can be classified based on the size of your red blood cells, measured by a value called mean corpuscular volume, or MCV. Let's break down the three main types: microcytic, macrocytic, and normocytic anemia. Starting with microcytic anemia. Microcytic anemia occurs when red blood cells are smaller than normal, usually due to iron deficiency. Iron is a key component of hemoglobin, so when your body doesn't have enough iron, it can't produce enough hemoglobin, leading to smaller, less effective red blood cells. Common causes include poor iron absorption, perhaps due to conditions like celiac disease or insufficient iron intake, especially in diets lacking in meat or leafy greens. The symptoms of microcytic anemia go beyond just fatigue and pallor. You might also experience brittle nails, hair loss, or even difficulty swallowing. Diagnosis involves blood tests to check hemoglobin levels, red blood cell count, and iron levels. Treatment usually includes iron supplements and dietary changes to increase iron intake. Moving on to macrocytic anemia. Macrocytic anemia is characterized by larger than normal red blood cells. Typically happens due to a deficiency in vitamin B12 or folic acid. These nutrients are essential for DNA synthesis, so when they're lacking, red blood cell production is impaired. The two most common forms of macrocytic anemia are megaloblastic macrocytic anemia and non-megaloblastic macrocytic anemia. Megaloblastic macrocytic anemia happens when you don't get enough vitamin B12 and B9, aka folate, affecting the process of RBC synthesis in the bone marrow, resulting in a larger and dysfunctional RBC, which also die earlier than normal. And non-megaloblastic macrocytic anemia happens due to a background medical conditions like hypothyroidism, alcoholism, and myelodysplastic syndrome. This type of anemia is common in people with poor dietary intake of B12, like vegetarians or those with absorption issues due to conditions like pernicious anemia. Symptoms might include a swollen tongue, neurological issues like tingling in the hands and feet, and even memory problems. A special test called the Schilling test can determine if your body's absorbing B12 properly. Treatment involves supplements or dietary adjustments to correct the deficiency. And finally, normocytic anemia. Normocytic anemia is when your red blood cells are normal in size, but their numbers are reduced. This can be due to various causes, such as chronic diseases, bone marrow disorders like aplastic anemia, or acute blood loss. In aplastic anemia, for example, the bone marrow fails to produce enough blood cells, which can be caused by factors such as radiation, certain medications, or infections. But in case of hemolytic anemia, which is another form of normocytic anemia, occurs when red blood cells are destroyed faster than they can be produced. Treatment for normocytic anemia varies widely depending on the underlying cause. It might involve blood transfusions, medications, or even a bone marrow transplant in severe cases. Diagnosing anemia is a step-by-step process that often begins with a complete blood count. This test measures your hemoglobin levels, hematocrit, which is the percentage of blood volume made up by red blood cells, and other key indicators. Depending on the presented symptoms and lab results, the physician might order additional tests, such as iron studies, vitamin B12 and folate levels, or even a bone marrow biopsy in more complex cases. Understanding the exact type of anemia the patient has is crucial for choosing the effective treatment. So how do we treat anemia? It really depends on the cause. Iron deficiency anemia, for example, is often treated with dietary changes and iron supplements, while vitamin B12 deficiency might require regular B12 injections or oral supplements. Beyond just treating the symptoms, managing anemia involves addressing the root cause, whether that's through improving your diet, managing chronic diseases, or, in more severe cases, considering options like blood transfusions or bone marrow transplants. Anemia isn't just a condition that can be fixed with a pill. It often requires a comprehensive approach that includes lifestyle changes. For example, incorporating iron-rich foods like lean meats, leafy greens, and legumes into your diet can make a big difference. For those with vitamin deficiencies, foods like fortified cereals, dairy products, and eggs are key. And if you're at risk of anemia due to chronic conditions, regular checkups and blood tests are essential to catch any issues early. Exercise, too, plays a role in managing anemia. While it might seem counterintuitive to work out when feeling tired, regular, moderate exercise can actually help improve circulation and increase patients' energy levels over time. Anemia may seem daunting, but with the right information and proactive management, it's a condition that can be effectively controlled. Remember, understanding the type of anemia you have is the first step toward effective treatment. Thanks for joining us today on Orange Zebra, where we're dedicated to making health knowledge accessible and engaging. If you found this video helpful, don't forget to give it a thumbs up, subscribe, and share it with someone who might benefit. And as always, stay healthy, stay informed, and we'll see you in the next video.